I'm Jeanette Wider, Managing Editor of Healthcare Innovation, and today I'm here with Justin Jacobson, Vice President of Patient Engagement for Nuance Communications, and Dr. Jared Pelo, Chief Clinical Product Officer of Nuance Communications. I'll let the two of you take it from here. Thanks.
Great. Thank you so much, Jeanette. I'm going to kick us off and then I'll hand it over to Justin shortly. But I'm excited to have time to spend with all of you today. Thanks for taking time out of your day to come and listen to us. I think we're both extremely passionate about the problems that we're working to solve. And I think we have some really interesting things to share with you. We also have Maria with us here. She's one of our solution consultants, and she's going to help us with some of our demonstrations. So to kick things off, we're just going to go ahead and look at our agenda. This is where we're going to talk about our industry trends today. We're going to talk about the clinician and patient experience. That's what it really boils down to. What is the experience for the caregiver and the person receiving care? We're going to show how this could work best over using some of the solutions that we've been able to bring to market and really show some great outcomes for a telehealth visit and then post-telehealth visit. And then lastly, we want to finish up with some question and answers. And if you put in any questions, we don't get to them today, then we'll follow up and get some answers out to you. So let's go ahead and jump in. First up, I just want to talk a little bit about, I think everybody remembers the day when they stopped going into the office and when telehealth changed across the world. And at the beginning of the COVID pandemic, I remember distinctly waking up that morning and thinking about our clients who were using an in-person solution and thinking, oh my goodness, we need to make sure this works in a telehealth way because everybody's going to need telehealth. And so we've seen this giant increase in utilization now, not as high as it was the day after COVID lockdown hit the US, but still a really big 38x use of virtual visits from pre-pandemic levels. And really, I think that as we continue to learn how to better use telehealth, we're actually going to see these numbers go back up. But 40% of patients say that they plan on continuing to use telehealth. And I would say those other 60%, they probably didn't have a great experience. And we're going to talk a little bit about how you can deliver a better experience for your patients. And 57% of clinicians, they view telehealth much more favorably, where before the pandemic, they thought of it as, you know, maybe I use this to engage one of my specialists on call, but I don't really want to connect with my patients in this way. But that's not how physicians are viewing this anymore. Physicians are viewing this as a really great way to have visits with patients and still connect with them and give great care. And 55% of patients say that they were more satisfied with telehealth visits than with in-person appointments. Now, we know the market is pushing us in this direction, huge investments in telehealth kind of across the board by healthcare organizations, technology companies, and total revenue of the top 60 healthcare payers is going up 83%. Now, none of this would have changed nearly as quickly without giant regulatory changes. I mean, there were all sorts of issues with different state licensing or the types of solutions that could be used, the types of solutions available. And so there's been huge stimulus and huge changes in the regulatory phase. And why? Why did this all come? We'll jump to the next slide. So I really think that the barriers that we were seeing pre-pandemic and those barriers that we're seeing today, they haven't really gone away. But I believe there are solutions to help solve these. And so number one, there's technical constraints. And for those of you who are providers or work with providers, you know that when the pandemic hit, you were trying whatever you could to connect with your patients. And probably there was a telehealth solution, but it didn't work great. And then you found yourself just on the phone talking to your patient and not having that video connection that you wanted to have, not being able to share things over that video connection. And there is this technological constraint. And there really is a need for patients to be able to say, hey, I'm having trouble logging in, and have an easy way to access help, to access technical help on what's the problem, why can't I get into this, and all these disparate systems that don't work together. So there is this real support part that we need to address in a holistic way. Now, physician burnout is one of those things that just continues to increase. It seems like we've tried solution after solution, meditation retreats, maybe it's that the provider doesn't have enough time off. But really in the end, what we find when we look at Medscape's burnout surveys from every year is that it comes down to more and more bureaucratic things that a provider has to do instead of take care of patients. And 42% of physicians are experiencing burnout today. And we know that when a physician is experiencing burnout, it's also a patient safety issue. They're twice as likely to make a medical error in the next 3 months if they're experiencing burnout. And 64% of physicians say that the pandemic only made burnout worse. And $4.6 billion cost is attributed to the healthcare system as a whole, caused by clinician burnout. And then, of course, there's this patient-clinician relationship that suffers when the clinician is stuck looking at the computer instead of making eye contact with the patient. And I heard this anecdotally from lots of my friends and family who were having these telehealth visits, and they were saying, you know what, it's almost worse because I find my clinician looking down or looking at another monitor instead of looking at me. Like I'm looking at them straight in the face and they're not looking at me in this telehealth visit. And so we know that patients, what they really want is this smooth, technology-enabled experience where they're connecting with their patients, they're able to get help, the technical help they need, all of those things. So let's go ahead to the next slide.
All right, well, I'm going to take over here. Thanks, Jared. And thank you everyone for joining us today. We really appreciate you taking time out of your schedule. And we want to make sure that this is beneficial to you. So a lot on this slide, but so many of the trends really point to the importance of self-service. Think about when you call your bank, or maybe you're planning on making some travel, you contact your airline, for example. You want to quickly and easily be able to resolve the issue on your own without waiting in a queue for 3 hours to get in touch with the representative. So the reality is that 85% of consumers do prefer to self-serve, and they expect to do so in a conversational way. But more importantly, they want to be able to do it on the channel of their choice. So as you can see here, 95% of consumers are reaching out to brands via more than one channel. And what we're seeing is that these consumers are very focused and intent on having a consistent experience regardless of the channel with which they contact someone. So with patients having such a wide range of options at their disposal, they are time and time again choosing providers based on their user experience. In fact, within the past year alone, as you can see here, there's been a 40% increase in patients who have switched providers due to a poor digital experience. And the data on the left hand of this slide really supports this, with a huge amount of turnover in patients since the start of the pandemic, similar to what Jared was outlining. Patients really expect to be treated as the individuals they are in the interactions they're having with your organization. And this megaphone style communication that so many organizations have done for years, where they're talking at or shouting to patients, it just doesn't work anymore. So it's really now incumbent on healthcare systems to demonstrate that they know what the patient wants when they're being passed off from a support agent to the patient access center. And importantly, they really want to know that that organization knows who that patient is, that they know who they are, and that they get a personalized experience. So with that, let's move to the next slide. So knowing this, how can organizations meet the demand for this highly personalized, frictionless interactions while also providing a better experience for clinicians? Because it's not just the patients that we're focused on, but obviously it's the clinical team as well. And really the answer centers around infusing intelligent automation and AI into virtually every step of the patient journey. This allows you to provide a seamless end-to-end experience that not only benefits the patients, but also the clinicians, while delivering organizational benefits. Key to this strategy is digital patient engagement and ambient clinical intelligence, that clinical intelligence behind the encounter, as Jared mentioned, because patients want to actually be interacting with their doctor. They don't want to see the back of their doctor as they're typing into to an EHR. So the key here is to provide this experience across all stages of the patient journey, as you can see here. So with that, let's move to the next slide, please. So what makes a superior patient experience? We know that patients want convenience, and we also know they want personalized communication. You know, they want to be able to get the information quickly, but they want it on their terms. They don't want to wait on hold, speak to a representative, or have to repeat the information several times. So they want and expect that their care providers know them, know why they're calling, and that all their information will be available and will be known by the care provider before they even pick up the phone. So patient engagement solutions can allow organizations to do that by delivering the context of the patient throughout the whole journey, minimizes the administrative burden on agents and care teams because it automates those tasks and offers self-service to patients. I'll touch on this a little bit more in the next slide, but let's stay on this one for a minute. So when we take a step back and we think specifically about the patient clinician experience, it's clear that documentation affects not only the clinician, but also the patient. I think we've all been in doctor's appointments where, again, you know, the doctor has to be focused on entering the information into the EHR. And that's just not an ideal patient experience, certainly not an ideal physician experience as well. And as Jared mentioned, the burnout numbers support that. So ambient clinical intelligence takes that burden away, and it restores the focus on the patient with the clinical documentation that writes itself. So when you take these two pieces and you put them together across the patient journey, you truly create an enhanced experience for the clinician and the patient while generating these additional benefits for your organization. So with that, let's move to the next slide. So the term patient engagement solutions can be very broad. You know, it supports different use cases, different modalities and channels. You probably all encountered a chatbot on the web that uses directed dialogue and it doesn't understand what you're saying. Or an endless phone tree that leads you to shouting into the phone, representative, you're hammering zero to try to get to a representative. There's a significant difference between these limited, siloed point solutions and a truly omnichannel patient engagement strategy. So I'll explain the difference quickly. An omnichannel patient engagement strategy allows for really four things I want to highlight here quickly. Personalized, natural interactions across the patient's channel of choice. So patients can interact anytime, anywhere, seamlessly across channels and still have that context. They don't have to repeat themselves. Number two, the elimination of these silos that I mentioned with a common infrastructure that leverages back-end integration. In other words, you build once and then you deploy across all channels. Number three is automated and human-assisted AI learning loop that continually improves performance. So when you've got a learning loop working behind this, it's constantly understanding what's happening so that you can better serve that patient in the future. And then fourth, seamless engagement transitions across digital or voice channels with access to live agents. We don't want to cut out the human agents. There's absolutely a place for that. In fact, what we want to do is help them to do their job more efficiently and have all the information they need so that when we sense the patient does need that help and we need to elevate to a live agent, that they can truly help them and pick right up where they had left off. So with that, let's move to the next slide and talk a bit about pre-visit. Where does this fit in the patient journey pre-visit? Jump to the next one quickly. On the pre-visit side, the patient experience begins far before a patient even steps in the door. Often the first impression is made via the patient access center when the patient calls in. So ensuring patients can schedule or reschedule an appointment or that patients can contact the right department seamlessly and efficiently is critical to attracting and retaining patients. In addition, you want to ensure that your patients are prepared for any upcoming appointments, whether that's reminding them to fast before their lab work or making sure they can access their patient portal. Let's go to one last slide here, and then we'll jump to demonstration. So before turning to a demonstration, let's talk specifically about the types of solutions that support a greatly improved patient experience. So tools such as IVR, interactive voice response, appointment management, and patient support enhance the patient experience while promoting patient care, preserving revenue, and controlling costs. We've seen organizations have great success by building a patient engagement strategy in areas that deliver quick, significant ROI. These organizations can expand additional use cases across the patient journey over time. But what we want to highlight today is these three areas that you see on the screen. So I'm going to briefly explain these. So I mentioned IVR, right? Interactive voice response, and that's in the patient access center. So think of that as greeting calls with conversational dialogue that prompts for need. How can I help you today, right? NLP running behind that determines the intent. What is the caller looking to do? And then the IVR replies with self-service options or routes appropriately. So that's one core pillar is IVR. A second is appointment management. So for appointment management, it's sending voice and SMS appointment reminders with the ability to confirm, cancel, or reschedule in real time on whatever channel the patient prefers. Also, it's fielding inbound voice appointment inquiries. Two other elements, sending ad hoc one-way messages over voice, email, or SMS, and then finally sending SMS messages for the EHR as an example. And then the third pillar we want to highlight is patient support. So patient support, really three key elements here that I highlight very briefly is the support for inbound patient inquiries on accessing their patient portal, right? Telehealth appointments. They want to prepare for a telehealth appointment or FAQs via voice or also via web chat. So again, supporting those inbound patient inquiries. Also outreach to enable telehealth appointment readiness over voice and SMS with automated support. So as a patient is preparing for a telehealth visit, obviously the focus of today's webinar, this is something that can be very effective to make sure that we reach out to the patients in advance and they're prepared accordingly. And then finally, patient support also serves as a service desk for patient portal live agent support for all kinds of issues. So there are a lot of things that we can deliver with patient support as part of the journey. But with that, I want to turn it over to, let's go to the next slide, and I'll turn it over to Maria, who will take us through a demo so you can see some of these solutions in action. Maria, go ahead, it's all yours.
Great, thank you, Justin. I'm going to go ahead and share my screen. And what you're seeing today is a couple of things. You are actually seeing our demo, Nuance demo portal. And this is what I'm going to be using as part of the Omnichannels that we're going to go through to see how we improve the patient's experience as they go through the process of not just appointment scheduling, but all those different processes and activities that the patient undergoes. We're managing their care that Justin and Jared had mentioned. So I'm starting with the portal as well as the phone. So I'm also mirroring my phone because I'm very busy. I live off my phone. If everything could be on my phone, it would be the greatest thing ever. So what we're going to first see today is really our patient engagement solutions and how we really focus on using that patient's preferred method of communication. So to interact with patients and also for the patients to be able to manage their care in this digital age. And as Justin mentioned, it uses conversational AI and natural language understanding to really connect with the patients no matter how they prefer to get in touch. And with that, we can also configure it unique to the organization's needs. So we're going to walk through the Omnichannels. You saw the portal, the phone itself, and also text, and as well as live agents, and all connected via API. And we're also going to look at the activities such as scheduling, reminders, patient support, message on demand, live agent escalation, FAQs, all those activities that a patient goes through as they manage their care. So what we're starting with today is basically I'm logged into the Nuance portal, the demo portal that you see here. And, I've been seeing my doctor because I haven't really been feeling well lately. And I'm not sure if I need to go see my doctor. So I'm going to go ahead and see what I can do to maybe, schedule a telehealth visit with my doctor. So Nuance makes it really easy for me, though, to really manage my care anytime on any channel from pre-visit through appointment follow-up. So that said, I'm going to go ahead and show you how we can take your appointment scheduling to that next level. So starting with the portal here, I'm going to go ahead and try to see what I can do about getting an appointment. Right away, a virtual assistant greets me. I'm not feeling well, but I'm not sure if I need to see a doctor. I've been having headaches and noticed my blood pressure has been running high the last few days. So at this point, your own triage or symptom checking logic will be able to help identify what kind or the length of appointment that a patient may need. So in my case, it looks like I need to see my doctor about my headaches and my blood pressure. So I'm going to go ahead and pick the time and date for me that works. Looks like Wednesday looks good. And what happens is with Nuance, it automates a text message that reminds me of that appointment. And it's going to include information that based on your symptom checking logic and your outbound messages, will be able to place whatever will be helpful for that and give that patient a really good experience. So for example, here, in our case, the text message here, it actually includes the phone number for the scheduling for me to have easy access to it if I need to. And your organization decides the timing, the vocabulary, and also confirmations that's needed from these automated messages. So things like parking or arrival instructions on these reminder messages can really help reduce a lot of those patient questions and keep those appointments running smoothly. So that being said, I'm looking at my date and time here, and you know what? That date and time actually is going to conflict with another appointment. Somebody put a meeting schedule on my invite at that time that I can't miss. So I'm going to have to reschedule it. And at this point, I can easily do that by using the number that's already provided for me on the text message. And with the natural conversation, I'm able to share my preferred appointment times, and the IVR also verifies my identity. So instead of getting a list of menu options, that Justin was saying, what I actually will get is an intelligent natural language voice system, and it's going to ask me.
Hi, Maria. I'm Riva. What can I do for you?
I'd like to reschedule my appointment.
No problem. For security reasons, what is your full name and date of birth?
Maria Gonzalez, January 22, 1987.
Thank you. I see that you currently have a telehealth appointment on Wednesday at 11:30 a.m. The next two openings I have in the morning are this Thursday at 8:45 a.m. or Friday at 10:20 a.m. Would either of these work for you?
Do you have anything available next week? Any day between 9 and 11, except on Wednesday?
Sure, let me check. Next week, I have two telehealth appointments available. Next Tuesday, the 3rd, 9:30 a.m. or Thursday, the 5th, 10:45 a.m. Would either of these work?
Let's go with Thursday.
Perfect. You're all set. We'll see you online next Thursday at 10:45 a.m. and we'll text you a reminder the day before. Need anything else?
No.
Thank you for contacting Nuance Health. Goodbye.
Great. So I was able to quickly reschedule that appointment with the links that was provided to me on the message. And here I actually got my date and time, my new date and time for the rescheduling of that appointment. And of course, I just remember I wanted to ask one question, even though I've told her that I didn't need anything else. I just remembered, but I can quickly ask that. Will I be seeing my own doctor or someone I don't know? So what I've done is I've actually used what we call frequently asked questions. And what that does is assist patients by really answering those questions that could be hard to find. So we might want to start with common questions like, hours or location addresses of the office, but it's really more complex and more strategic than that, because we actually use our analytics to help continue to revise those questions that you may want answered in your FAQ database. So all is set, and now we're going to fast forward to the day of my visit here, and I'm going to go ahead and log into my telehealth visit with my doctor. And so I'm going to go into my portal. I'm going to log into that video visit, and it's going to ask me for my email here and my password, which of course I forgot. I have so many, it's hard to remember all of them. But luckily, with patient support, the patient engagement solution will provide me with quick virtual assistant to help me out. So patient support provides me with those services that, for issuing accounts, virtual visit preps, or in this case, password recovery, to help reduce a lot of those call volumes to only those calls that may require a live agent. And so those services actually include inbound and outbound support as well. So right away, I'm already being prompted for the issue at hand. I can just use that. And then it looks like it's asking me for some information. So I'm going to go ahead and answer that. Maria Gonzalez, January 22, 1987. Four, 5, 4, 6. All right, so right away, it's going to take care of me. I just need a new password reset here, and I can quickly do that. Everybody look away so you won't see my password. And then as I make that change, I'm already set, and I'm now going to get connected. I'm just going to wait for my doctor to go ahead and connect to the video visit. So right now, I can go ahead and actually take advantage of some frequently asked questions. I had another question in mind that I forgot to ask earlier. What about prescriptions? Can I get them filled? Wonderful. So that's good to know that I can just take care of that during the visit as well. All right. Oh, looks like I've got a video connection error, so I won't be able to connect quite yet, but easily I can go ahead and connect with the virtual assistant for support. I'm having trouble connecting to my video visit. My video. It's a Mac and I'm using Safari. Yes, error 10263. All right, so at this point, the AI has actually suggested that I go ahead and talk to a live agent. So these are the kind of issues that at this point require a live agent. So what we noticed is that, there's very much challenges that organizations actually experiences around staffing and support. But this sometimes, technology is helpful, but then sometimes the patient really needs to talk to that human intervention. So with that human intervention, we can help with that by providing a lot of efficiencies with the technology. For example, providing a lot of the details that's already required for the live agent to be able to help me. So at this point, I was actually got the help that I needed, and I was able to connect with the doctor. So at this point, we're going to actually now go into the telehealth visit ourselves. So I'm going to pass it over to Jared real quick here, who is going to really show you how we help improve that patient experience while we also improve the efficiency for provider documentation and help relieve a lot of that documentation and burnout for the provider. So also improving their experience as well. So Jared, I'm going to go ahead and unshare my screen so you can take over here.
Thanks, Maria. All right. Maria, thank you so much. That was awesome to see the technology at work. Now, Maria's in my virtual waiting room. I'm going to be playing the role of Dr. Oliva today, and we'll get to showing you how Dragon Ambient Experience works over telehealth and talk to that. But one really neat thing is that at the beginning of the pandemic was the same time that we were launching Dragon Ambient Experience. And to us at the time, it seemed like it couldn't have been worse timing to be launching a new technology into healthcare when everything is in commotion and in flux. And what we've been able to learn over the last 2.5 years is that it was the right thing. It was what was needed by healthcare at that time. And what we've seen is just better patient experience, better physician experience by using Dragon Ambient Experience. So I'm going to talk a little bit about that now. Next slide. So what you really find with Dragon Ambient Experience is we're trying to solve for that ability for the doctor and the patient to focus on each other and connect as human beings. And we do that by capturing that conversation. And, I have some providers who use Dragon Ambient Experience DAX who have known their patients for 20 years. And they generally start off with talking the first 15 minutes of the visit about families, hobbies, and we want them to be able to do that and then go into that deep clinical visit and have that documentation all captured, and have a machine that is smart enough to filter out that first 15 minutes of hobbies and families and bring all the clinical information into the clinical note and put it directly in the EHR. And we've been able to see this better clinician experience. We've also been able to see outcomes for organizations who invest in DAX. They have incremental revenue increases, their accuracy of their notes go up because we're actually capturing the full conversation and then creating a note from that. We're not relying on physicians' memory that could be, 2 days old, 2 weeks old. And you see increased retention of providers. We see providers who say they were about to stop practicing medicine saying that they feel like they can practice for 10 more years. So it's been super fulfilling to see what DAX has been able to achieve. And the way that we do this is we use a mobile application that is able to capture the conversation either in person or via telehealth. And the great thing about the mobile application is it gives us ultimate flexibility. You can use any telehealth, any video conferencing platform to go ahead and launch the application, select your patient from your schedule, and then go ahead and have your conversation with the patient. It's all securely captured on the mobile application, streamed up to our HIPAA compliant cloud. It's all 100% secure. While that data is on your phone, it's 100% encrypted. You can't even access it as the provider until it's up on the cloud, and then you're able to stream it back. But other than that, there is 100% security kind of built in from the beginning. And I spoke to this as we launched during COVID. We thought, okay, this will be very interesting. What are the outcomes going to be as we measure these months, years down the road? And we've seen that providers across specialties save on average 7 minutes of time per patient. And it's not time that they're saving not spending with the patient. They're actually spending time, maybe even a little bit more with their patients. They're saving that time on the documentation, the bureaucratic tasks that they have to do when they're not with their patient, or with their patient not focusing on them. And because of this, we've seen providers adding 3 to 5 more appointments per day. Now, you might think, okay, well, providers aren't going to be happy about adding more patients, but actually 93% of providers say that they would be disappointed if DAX was taken away. And 9 out of 10 physicians would recommend DAX, with the 70% reduction in feelings of burnout and fatigue, which I just think is huge. And as I already spoke about, patient safety, longevity of your providers' willingness to stay on, the ability to recruit new providers, all of that goes up. And providers don't just like DAX because it helps take care of something they didn't want to do. It does a better job than they were doing. 79% of physicians say that DAX improves the quality of their documentation, and a 40% increase in first-time approval of prior authorizations. And where we see organizations really digging into this time savings and reinvesting that in the ability to bring in more patients, we've seen anywhere from $100,000 to $500,000 in incremental revenue potential. Now, this is all good, but what about the patient? Does the patient like it? Well, the patient loves it. The patient loves having their physician focused on them. 83% say their physicians are more personable, 81% that they're more focused on them, and 75% they're spending less time on their computers and more time thinking about them. So with that, I'm going to go ahead and enter into my video waiting room. And I'm going to stop sharing the screen now, and we're going to go into a live demonstration with Maria and I. So as I enter into the video conference, I'm just going to say hi to Maria. I'm going to consent her to be recorded, and then we're just going to go ahead and jump in. And of course, I already know why she's here, because she told the health system when she was scheduling that. So hi, Maria. Dr. Pelo, how are you doing?
Hey, Dr. Pelo. I'm not so great, unfortunately.
Oh, I'm so sorry. I'm going to be recording our conversation for documentation purposes. It's going to help me focus on you. Are you okay with that?
Yeah, that's fine.
All right, great. And now I'm going to tell my system a little bit about you, and then I'm going to ask you some questions.
Okay.
So Maria is a 35-year-old female. She's here with complaint of headache. She has a history of hypertension and diabetes. So Maria, tell me what's going on.
Yeah, lately I've just been having quite a bit of a headache. And I mean, every now and then I'll get it, but lately it's just been getting worse. And I've noticed that my blood pressure's been running high. I've been taking it maybe like once a week, but the past 3 weeks it's been really high than usual. So I was a little worried.
Do you remember the numbers that you're getting on your blood pressure readings?
Yeah, so one of them was like 160/87, and then the last one was like 175/92.
Okay, so it's really high. I was looking back, and it looks like your blood pressure was pretty normal last time we saw you, is 124/82. Have you been able to take your blood pressure medicine, the lisinopril that you've been prescribed?
I have, but sometimes I forget. I'm kind of embarrassed to tell you that, but yeah, sometimes I forget. I get busy, like especially on the weekends. I'm very good during the week, but on the weekends I tend to forget it, and that's when I'm most busy too.
Yeah. Well, I'm also curious, you have diabetes. Have you been checking your blood sugar?
Yeah, I have, because I thought maybe, that's why I'm getting the headaches. Maybe my sugar was too low or maybe too high, but my sugar has been okay. It's been running like 120. Sometimes it does get down to like 100.
Okay. And have you noticed, are you urinating more than usual or anything like that?
Not really so much. It's been pretty much the same, but pretty normal.
Okay. And when you get these headaches, what are you taking for them?
Well, I take my Tylenol, hoping it'll just, go away. And then it does some just for a little bit, but then it just goes throughout the day and I start to get them again.
Okay. And when you first have the headaches, what would you rate the headache at? 0, no pain, 10, the worst pain ever.
I would say when I first get them, it's about, I would say a 7/10.
Okay.
Yeah.
And then after you take the Tylenol, what does it go down to?
It goes down to probably about a 4, maybe 5. I still feel it. I still feel it gnawing, but it's not as pounding as it normally would be if I
Okay.
didn't take the Tylenol.
Yeah. And have you ever had headaches like this before?
Not like this. As you know, sometimes I get a migraine, but I know I never really take anything for it. That's like once a year or once or every 2 years, but not like this one, headaches like this one.
Okay. And have you had any congestion, anything like that? Cough, runny nose?
Yeah, I thought maybe because now it's springtime and I tend to get my allergies, but it's very different. And I've not actually had any like runny nose or cough or congestion along with a headache.
Okay. If you tap on your forehead, do you have any tenderness?
Right here,
Yeah.
just a little, not really too much.
Okay. If you tap down here on these bones, your cheekbones, any tenderness there?
A little bit, not as much as if I tap up here,
Okay.
forehead.
And then if you kind of push on your neck around here, any tenderness?
It's a little tender, but it's not, yeah, just a little bit, I'd say.
Okay. Okay. So you don't have any frontal sinus tenderness, no maxillary sinus tenderness. It sounds like you don't have any lymphadenopathy. That would just be if your lymph nodes were tender.
Okay.
So, yeah, let's just talk about a few things that I want to do, and then I want you to actually come in and be seen by Dr. Oliva. So first off, your headache. I think taking Tylenol is great. You can keep taking that. Your lisinopril, you're on 20 milligrams once a day, which is a medium dose.
Okay.
But I think we can increase that. So for your hypertension and your headaches, I'm going to have you increase your lisinopril to 40 milligrams once a day.
Okay.
And then I want you to keep checking your blood pressure. And I want to order some blood tests. I'd like to get some just normal blood work. We'll get a hemoglobin A1C, some laboratory tests, things like that. And then for your diabetes, I'm going to have some diabetic education for you that I want you to be able to review. It sounds like your blood sugar has been running a little bit high. And after you get the blood tests, after that's all done, I want you to come in to see me or Dr. Oliva, and we'll just make sure that everything's okay, that we get your blood pressure under control. Any questions for me?
No, I mean, I've been walking and I know I get the headaches. Is it all right if I still continue my walks?
Yeah, that's great. I think exercise is wonderful for everything going on. Go ahead and walk still.
Okay, great. We'll do that. Thank
All
you.
right. You're welcome. Thanks so much, Maria.
Thank you.
All right. And with that, I'm just going to go ahead and hit stop on my recording. Now, I'm going to explain what you're going to see here. What Dragon Ambient Experience does is record that natural conversation, and it separates out the speakers and then sends it through natural language generation. That natural language generation produces an AI note, a clinical note. Now, if I'm a user of DAX today, that goes to quality review. And within 4 to 24 hours, depending on your practice, that quality reviewed note that's nearly 100% accurate gets put into your EHR. Today, I want to show you the magic of our AI. So this will not be quality reviewed. Obviously, it hasn't been 4 to 24 hours. You're going to see the magic of what our AI is able to do. So I'm going to first share my screen and then show you what I'm looking at. All right. So as we head over, we'll see that Maria Gonzalez is my patient, and she's here for her headache. And I'm going to kind of be quiet or maybe talk a little bit as we read over this note together. I'm going to try to zoom in a little bit, make it a little bit more legible for everybody. So these little blanks, I would just go ahead and fill that in with what Maria told me about her blood pressure. You know, she talks about how sometimes she forgets, especially on the weekends. Talks about her blood sugars, pain scale, captured all of that really accurately. Also talks about how I asked her about, you know, sinus infection, things like that going on. So did a great job capturing my history of present illness. You'll notice I asked some other review of system questions. And then because I am tuned for in-person, it also pulled in my physical exam template, which is just fine. I would just go ahead and delete out what I don't need. And we'll see that it was able to pull in that there was no lymphadenopathy. I called that out. And then we'll move on down to my assessment and plan, where you'll see hypertension and headaches, that I'm going to increase her lisinopril, and I'm going to be ordering some blood tests for her diabetes, diabetic education, have her come and see Dr. Oliva, make sure everything's under control. So to me, every time I see this, I think it's magic. Hopefully you get the idea of what Dragon Ambient Experience is able to do by automatically writing notes for us. I'm going to go ahead and stop sharing my screen and hand it back for more discussions of patient engagement and demonstration.
Great.
All right.
Thanks, Dr. Pelo. I'm going to go ahead and share my screen here real quick. So, you know, after the visit, it was good to see Dr. Pelo, and that, you know, he had some things for me to do and make sure that I keep my blood pressure in check here. And he actually did some blood work, as he mentioned. And so after the visit itself, right away, you know, I get my test results through my phone here as a text message. And what's great about this is part of the our patient engagement message on demand. And what it does is provide me with actually like a link in the text that allows me to access directly to get my results. And so messaging on demand is great for patients like me, because it can be done for various reasons. So one of them, it can also ensure that, you know, patient really has timely access to the most needed information. So for things like weather closures, of the office or alerts of test results, like in this case, and even things like a pre-appointment instructions. And it can really be used for internal messages as well. So for example, it can be used for alerting housekeeping of teams that are, for rooms that are ready to be cleaned, and also for even transporters if a patient needs to be moved. So this allows me to, again, access my information and manage my care pretty immediately as I need to. And let me go ahead and click on that. I can quickly manage my care and then see the test results right after my visit with Dr. Pelo. So we saw in many ways, how nuanced patient engagement really helps organize and helps organizations as well in real time with patients and how they can use their preferred method of communication to really manage their care. We saw appointment management, we saw patient support, live agent support, and FAQs, and how it can be configured unique to your organization's needs. And personalizing that experience with that true omnichannel, that artificial intelligence, and that interactive voice response, as well as natural language understanding, all that really was able to optimize my experience, and as well for the staff that helped take care of me and the patient. So at this point, I'm going to go ahead and give it back to Justin here and stop my sharing.
All right, very good. Thanks, Maria. So there's a lot going on this slide. Let's just wrap up with 2 slides, this one and then one more. So thank you so much for the time today, and then we'd love to get to your questions. I'm glad they've been coming in. So as you look across the patient journey here, right, you can see we've covered everything from pre to during, in this case, a telehealth visit, and then now post-visit via the discussion today. It's important to stay connected to your patients after their visit for a variety of reasons. You want to make sure that they have access to their care plan information and their patient portal, and that they're reminded of the steps that they need to take to ensure good health. But rather than putting the burden on the patient to remember all of that information and reach out to the provider if they don't, proactive outreach reverses that paradigm. And it can be automated for a variety of use cases. So in short, what we do is we help you automate those tasks and those communications necessary to ensure that patients after their visit follow their care plan and instructions after the appointment is over. So we always have the end goal in mind here, which is to support the patient's health, right? It's difficult, frankly, it's unsustainable to manage patient care on an individual basis. Adherence to treatment plans and follow-up care is hard to track. So the ability to automate consistent messages and reminders without requiring extra effort from providers strengthens adherence, it improves patient outcomes, and that consistent communication strengthens the relationship between the patient and the provider. So with that, let's go to the last slide here, capture very briefly the key benefits of patient engagement. So together, patient engagement solutions and ambient clinical intelligence can transform the patient-clinician experience while driving a whole multitude of benefits, right? And you can see 4 of the key benefits that our providers have called out here. So for our, that we call out is patients are just delighted with their care. It's one thing to have satisfaction. This is a completely different experience for patients. Jared talked about physician burnout, how it's a real and growing problem, and this truly lessens that issue so that physicians can focus on their patients. It does promote patient care and preserve revenue as well as control costs. So an example there is when we lift this burden from the clinical staff, right? When we gave you a couple examples where we automate tasks, right? Or when we provide information to the patient access center so that they can have that experience that the patient expects and the patient doesn't have to repeat themselves. All those things make for greater efficiency, it reduces cost, and at the same time, there's a better experience for the patient. So with that, let's turn to questions.
Okay, and I'm back. We already have a bunch of questions that have come in, but the wonderful folks at Nuance let me know that if you have any questions that don't get answered, they will work on getting you some responses. So the first question I have here is for Justin. Where should an organization start with a patient engagement strategy?
Yeah, good question. I think a lot of folks are tempted to try to change everything all at once. And the providers that we work with have really found that the best, that's the end goal. That might be the vision, right? But the best way to approach it is to work through manageable chunks. And the three that we consistently see are, again, patient access via IVR, interactive voice response, patient support, right? Password resets, telehealth support, like we talked about today, and then appointment reminders and rescheduling. But if you force me to choose one of those three, it's appointment reminders and rescheduling. And the reason why that is so important is that, again, with clinicians being so overburdened and their panels being full, being able to automate just that portion of appointment reminders and rescheduling can really, really help free up the clinical staff more, right? They still are able to see their patients, but they can do it much more efficiently. So if you force me, I would go down the appointment reminder and rescheduling.
Okay, great. So, and the next question is also for you, Justin.
Okay.
What is patient engagement's role in helping your patients reach their highest potential for good health?
Oh, good. I'd say the primary role of patient engagement is helping a patient have not only access to more of their healthcare information, but be able to take more ownership of it, right? So whatever we talked about, right? Things like the IVR, where a patient calls in and, how can I help you today? Well, does that give them more access or information to their care? Not necessarily, but they have a much better experience. Appointment reminders and rescheduling certainly does, and patient support absolutely does. So it's kind of a combination, right? It's part of it is just making sure that the consumer has an experience that they come to expect in online shopping or travel or financial services. But when it comes to actually taking control of their health, it's giving them the information that they need so that when they go to see their provider, they're much better informed. The example with Jared and Maria of having their information, take control of the health, and wanting the doctor to be able to advise with information that the patient is able to provide because they're very invested in their care and they have access to that, goes a long, long way.
Okay, so Dr. Pelo, this one is for you. Does DAX eliminate unnecessary information and dialogue? If so, how?
Oh, that's always an interesting question. People wonder, is this just going to be speech recognition that I put in my EHR? No, it's not. And, the demo that you saw today was really pretty short, abbreviated. Maria and I are great friends. If we had more time, we would have talked a lot longer, and we would have talked about interesting things and things that aren't necessarily medically relevant. And what you would have seen is DAX would have cut those things out and only listened to the things that were medically relevant about her hypertension or headache and her diabetes, and pulled those things in. And the reason DAX is so good at that is it's built on real data. Millions, nearly 5 million of these paired recordings and final notes in 32 different specialties. And so because of that rich data set, the AI just gets smarter and smarter at knowing what is medically relevant. What does a doctor really want in their note? And so it does cut out that unnecessary dialogue, and it does it with that high learning from the AI.
Okay, and Dr. Pelo, I believe we only have time for one more question. So this last one's for you. How can people get started with DAX?
Oh, well, that's my favorite question. So first off, reach out to your sales associate. They're happy to engage and show you ROI. We have ROI calculators that they can step you through. How can you justify spending money on documentation? And it's not difficult to justify because there is such a great ROI with provider satisfaction, patient satisfaction. And I think of it a lot like the patient engagement solution. It's almost like, how can you afford not to invest in this? It's what your patients want, it's what you want, and it's going to have better outcomes for everybody across the board. So yeah, please reach out. We're happy to meet with you, talk to you, and show you what we can do for you.